My name is David Baglow. I'm a physiotherapist working in outpatient respiratory here at the LGH. And I actually started working for the Tasmanian Health Service in 2019 at the Mersey, but I transferred across to the Launceston General Hospital in March in 2020. So this research project is what we call a longitudinal observational study. So it's a study that's looking at the experiences of people with chronic obstructive pulmonary disease, or COPD, and their caregivers in the year after an episode of life-threatening breathlessness where they've ended up in hospital. And whether in that time, whether any what we might call existential concerns or distress arises in that time, particularly in relation to how the symptoms they experience, things like severe breathlessness as well in that time. So much of the work that I do as a physiotherapist in the outpatient respiratory space is with people after they've had an admission to hospital because of their lung disease. And usually it's quite soon after that as well too. What became quite clear in working in this space as well too is that people often experience these episodes as very frightening, and there can often be quite a lot of psychological suffering in the time after that as well. People often talked about their breathlessness both at the time when they're in hospital and afterwards in terms that we might call existential. So they'd say things like, "I thought I was going to die," or "I don't know where my next breath is coming from," or they often say things like, they don't know what the future's going to look like. There's quite a bit of literature looking at existential concerns or distress in people with serious cancers, but not much when it comes to people with serious lung disease. In people with serious cancers, it's associated with things like more anxiety and depression. It's associated with things like avoidance and resignation when it comes to managing their health condition, rather than sort of more helpful approaches. And it's also associated with overall lower quality of life. So I thought it worthwhile then actually exploring in this year afterwards the experiences that people have in greater detail, and in doing so potentially help to then facilitate more support for people as well too through appropriate services like psychology services or like palliative care services that are really underutilised in people with serious lung disease. In terms of why carers and loved ones are included, but in particular carers, it's because it's a real recognition that people generally don't manage these conditions alone. These conditions really can affect the quality of life, both of the person and with those around them as well too, that are helping to try and support them. So it's really trying to consider more holistically the approach to caring for people with lung disease and those around them as a sort of unit, and how we provide the support to that unit as well. And if we don't actually investigate the experiences of the carers as well too, then there's potentially a missed opportunity to really support people holistically. Our hopes in terms of the research project is by further exploring the experiences of people in the year afterwards and their carers, is that we're going to be able to hopefully be better at identifying existential concerns and distress when they arise, and in doing so be able to link them in with the appropriate services as well too. This research will provide greater insight into the experiences of people with COPD, with chronic obstructive pulmonary disease, and their caregivers in the year after a life-threatening episode of breathlessness. In exploring these experiences further and the sort of existential dynamics of living with a lung disease after almost dying from it, we're hoping that we're then able to find ways of promoting more resilience, of promoting positive health behaviour changes as well too, by being able to facilitate better support for people with chronic lung disease. So in terms of how the northern Tasmanian community will be affected, we'll change the model of care and number of the services that we provide here locally. So that's partly through the outpatient respiratory physio service. So we have a fantastic multidisciplinary team that's involved on the project, inclusive of one of our local senior clinical psychologists, one of our local respiratory and lung transplant physicians as well as a number of physiotherapists who have many years of experience of working with chronic lung disease. Essentially through this process of research and collaboration, we're looking at developing different models of care for working with people with serious lung disease in order to help promote resilience and positive health behaviour change, as well as to help support the carer in their role as well too. This research is probably one step back from looking at whether an intervention, well, it's a couple of steps back from whether an intervention that we do will actually change outcomes in terms of hospital admissions. But what it is doing is it's looking at some of the factors as to why people may or may not engage in positive health behaviour change in the year afterwards. And that in itself, I think, is a really important factor, because we do know there's some really good evidence-based things that people can do, like pulmonary rehabilitation, like adhering to their medications, like making sure they see their doctors in appropriate timeframes, particularly when they have flare-ups. I'd love to say a huge thank you to the Clifford Craig donors. It's certainly without their generosity, this project just wouldn't be possible.